From the RSNA, welcome to the Radiology Imaging Cancer Journal podcast, hosted by the Trainee Editorial Board. My name is Brennan from Case Western Reserve University with my colleagues Tom, also from Case Western University, as well as Yash from the Mayo Clinic. We are here in person, finally, to talk about our experiences as the Trainee Editorial Board members, as well as talk about our experiences at RSNA in general so far. So let's get into it. Hello, guys. How you doing?
Good, Brennan. How are you?
Hi, good. Brandon, how are you doing?
I'm doing pretty well. A little overwhelmed by all the experiences available here at RSNA. It's my first time at the conference, so can be a little overwhelming, but having a great time. And it's great to see you guys both in person finally.
So, two things. It is amazing how many exhibits there are here at RSNA. Trying to keep track of them all is almost impossible, but it's like so exciting. And yes, like Brennan said, this is our first time recording a live in-person podcast. So that's like super exciting.
So we wanted to talk about a few things, but first I want to ask my two colleagues, why did you want to join the Trainee Editorial Board of Radiology Imaging Cancer? Yash, do you want to go first?
Hi, I am Yash Singh from Mayo Clinic. As a trainee editorial board member of Radiology Imaging Cancer, my journey has been exceptionally enriching. Being a part of this prestigious journal, this has provided me very invaluable insights into the peer review process and scientific publishing. Honestly, like when you are reviewing the manuscript, each manuscript that offers that very unique learning opportunity and allowing to critically evaluate the methodology and assess the clinical relevance and identify both its strength and the limitations in the current research approach. Also, this is the in radiology imaging cancer, the very unique thing that we do have a mentorship from the deputy editor, which is like very fruitful also. So their guidance in navigating very complex review decision and understanding publication standard has enhanced my analytical skills significantly. The collaborative discussion about manuscript strengths and weaknesses have sharpened my scientific acumen.
So Tom, what do you think?
Yeah, I mean, Yash's answers hit a lot of great points. Definitely agree with him on all those points, but something that I want to add for me personally is, I'm coming from a computational background where I'm developing AI methods for predicting treatment response in bowel diseases, mainly rectal cancers. So a lot of the work and papers I read are very technically focused. And so being part of the Trainee Editorial Board is giving me a much broader perspective of medical imaging, radiology. And so it's really interesting to see how researchers out there are improving existing imaging methods or, trying to invent new ones and how they're applied to a variety of cancers and how each cancer requires a very unique approach to how we're looking at that particular cancer. So I think it's really just broadening my horizon. And, I think especially, throughout PhD programs, it can be very easily get siloed into one area. And I think this has just been such a wonderful opportunity to kind of expand the scope and really understand, okay, what are the major challenges out there with imaging and like, for example, breast cancer, prostate cancer. So I think from that point, it's been huge for me. And I think also, again, my background coming from AI, we do see a fair amount of papers that discuss AI in cancer imaging. And I think because we are a more clinically focused journal, it's really great to see the clinical implications of these AI algorithms. And what are we looking for to ensure that these AI algorithms, like, yes, they work, but are they really ready for clinical translation? The translational feasibility of these algorithms is a really important criteria we look at when we're evaluating these papers. And so kind of understanding the different insights or criteria we're using to understand how we can better translate or whether or not these algorithms can even be translated into the clinical setting. So that's what I would say.
And also, I would like to add one last point from my perspective. So, radiology imaging cancer has a very, very strong visibility in the radiology community and also cancer research community, and contributing to the journal that shapes cancer imaging practice worldwide is both humbling and motivating, making this editorial traineeship and cornerstone of the professional growth.
I think that's a great point, Yash. The fact that it has that visibility is why our journal gets a lot of different types of papers and a lot of different types of studies. Although, like you said, Tom, we are more clinically focused. We do review a lot of AI papers. And the reason we're getting this diverse set of papers is because we have that visibility, we have that impact. I mean, I'm very grateful to be a part of that as well. To your first point, Tom, one of the reasons that I really wanted to be a part of the editorial board was to get exposure to those different kinds of studies. Again, like you, I've been almost siloed, like you said, in the machine learning and deep learning papers that come out of various journals. And while I take a lot of value from those studies, they are extremely technically focused with very little attention paid to how those models will be deployed and what impact they will have in a clinical setting. I think our journal does a really good job, and one of the things that I've learned the most from at determining what specific aspects of a model or technique need to be present and evidence provided for in these papers in order for it to be impactful. We look for those types of things. We look for evidence that a technique, an imaging technique, AI technique, whatever it happens to be, is going to be clinically impactful in order for it to be a part of our journal. And learning what actually qualifies as clinically impactful was the thing I wanted to really get out of this process of being a trainee editorial board member. And I think I've been able to do that. I'm really happy that I've learned these things, which brings me to my next question, which was about what we've all learned as part of this process. What are some of the things that you two have learned as being part of the trainee editorial board that maybe we haven't mentioned so far?
Yeah, so I think maybe more concretely in terms of reviewing new science, I think one of the biggest lessons I've learned is that whether it's an AI application or enhancing a new imaging method, there has to be sufficient context to justify what the study is investigating and how those results figure into the current landscape of that problem. I guess, for example, if you were to have some sort of, let's say, prostate cancer segmentation algorithm or prostate cancer detection algorithm, several of them have been proposed. So if you're proposing a new one, what makes yours different? And what are the current limitations of existing algorithms? And how is yours addressing one or several of those? So I think that is a really important point. And again, not just for AI studies, I mean, any studies in general, but it is so important to make sure that you're providing enough context to the reader so they understand where the scope of work fits in the landscape.
So what I have learned so far, so it's like the very important things, how to critically evaluate the manuscript for a scientific rigor and novelty and clinical impact. And also the importance of the when authors submit. So getting the constructive feedback that helps authors to improve their work. So these are the kind of things that I have been learning, and also differentiating between the incremental advances and breakthrough discoveries. So that's kind of I would say.
Yeah, I think that's a great point. To actually differentiate those studies, one of the things that I think I've really learned is kind of to shift my attention to different portions of the paper. So like to our previous discussion of having more of an exposure to computational papers before coming to this, Tom and I would primarily focus on the methods section of those papers, these very technical computational papers. And that's because in order to establish rigor for these types of methods, generally you want to make sure that all the technical content is sound. Now, we still do that going into the Radiology Imaging Cancer journal submissions, but on top of that, I've really learned to pay attention to the introduction, not just as a setup for the rest of the paper, but also just as the authors being able to establish a strong clinical reasoning for the entire rest of the paper. So it's not just getting people up to speed on the information they need to know. It's actually establishing why the study happened in the first place. And learning how to do that was a learning curve for me. There is some context where you might take that for granted and you might just assume that the reader knows that what you're doing is important. But that's not always the case. And I think Radiology, Imaging, Cancer does a great job of making sure that no, not everyone reading this paper will know that what you're doing is important. You must make sure that this study has been designed from the ground up to approach an important problem. Learning how to identify studies that have been done that way, to the point that Yash made about rigor, that was a new addition to my skill set, which I'm obviously still developing as a trainee editorial board member.
So do you think coming from a more, and this is the question for both of you, do you think coming from a more like technical background, do you feel that when we're reviewing papers for radiology, imaging, cancer, that we also put strong emphasis on the discussion section? So you develop this new imaging technique and you have these really awesome results, whether, better image quality, but why is it working? And again, how do these results compare? Do you feel, coming from a more technical background, that we're emphasizing this discussion section more in these reviews?
So I personally when I read the paper, I like to read the methodology, and definitely I do have a good balance of understanding the technical knowledge and also the understanding the clinical problem, that what are they trying to solve. So my approach is kind of reading the results, what are they publishing or what are they have produced the results, and on the basis of just you will get the sense that this study is feasible or not, and is that possible to bring into the clinical practice and solving and just understanding the complex disease. So that's a I would say.
Yeah, I think every reviewer wants to maintain that balance that you're mentioning between the different sections of the paper and really proportioning equal attention to everything. But I don't think we naturally have that inclination. To your point about how much are we actually putting emphasis on a discussion versus the results versus the methods, etc. I think personally as a reviewer, discussion is one of my least weighted sections. If I had to admit that, I'd say, methods is definitely the highest for me personally, and introduction is also really important for the reasons that I mentioned previously. But you're right that the discussion establishes really important points that need to be considered, and that is putting the work in the context of everything else that has been done previously. Discussing whether or not this is a monumental leap, an incremental leap. Where does that progress place on a scale of the previous work that's been established? So I think every reviewer is going to pay attention to these different sections in different ways, but coming from that technical background, I think at least I tend to put more emphasis on the methods versus the discussion. That's been my experience.
Yeah, totally. As we're kind of talking about how we're maybe weighting certain sections, or again, putting novel work in the context of prior work, one of the things that comes to my mind is, okay, so I now know where this work fits in the current landscape. I understand their methods. The results look great. But I think the next step is looking at translational feasibility. So is this ready, or does it have significant potential to be validated on, let's say, prospective studies? I think that's a really, and one of the things I really enjoy about being on the Radiology, Imaging, Cancer trainee editorial board is I think the emphasis of translational feasibility in this journal is really awesome, because it's great. You can make the most sophisticated imaging method ever, but if it cannot be practically deployed, then how are we supposed to react, right? Sure, it demonstrates great potential, but how can we take that to the next step? So I wanted to get your thoughts on this.
Yeah, the both novelty and feasibility work both have merits and demerits. So truly that impactful papers that balance innovation with practicality and groundbreaking concepts that can actually be implemented clinically. And being as a reviewer, I have learned the best research pushes the boundaries while remaining reproducible and applicable to the real world patient's care setting.
Yeah, I think that's really important. You have to toe a line, at least. Radiology imaging cancer is very focused on practical clinical application. Like Tom said, you can come up with these crazy methodologies, and there are journals for those methodologies. If it is not clearly clinically relevant or impactful, then that's not necessarily a fit for radiology imaging cancer, which I think is a good thing to learn as part of this, is that research has its place in different journals, in different settings. We have these inclinations and these focuses because that's what our journal is designed for. But there are other journals, even in the RSNA suite, that are fit for other types of research. So I think that's another big thing that I think we've all learned. We can look at these papers and say, hey, this was a good study. I don't think it fits in this journal. And that's happened before.
Yeah, Brennan, you bring up a really great point, is you also have to keep in mind the audience of the journal that you're reviewing for, especially as a trainee. And again, coming from a technical background, like the journals I typically review for have been very technically focused. And so now switching to a clinically focused journal does change the way you look at articles that you're reviewing, because they have to be appreciated by the audience, because that's when they're going to make the most impact. So I think that's a big lesson that I've learned, still learning. And yeah, I think that's what makes being on the training editorial board so cool.
I wanted to know about you, Brennan and Tom. Like, what was your experience so far, like attending RSNA? I know, Brennan, you are attending first time. So, what was your experience so far? And Tom, you have been attended already. So, what was your experience so far attending RSNA?
So first, I mean, I think I've already mentioned this conference can be quite overwhelming. It is tremendous to see so many people dedicated to improving healthcare in all sorts of different ways here in one place. I never imagined having so many people here at once that all focused on different unique aspects of healthcare. And it really does inspire a lot of hope, I think, for many different diseases and conditions and improving the lives of people all around, North America and the world. There's a lot of value that we're seeing here. So I really appreciated that coming here for the first time, seeing a real camaraderie amongst everyone. Everyone is here to improve something, and we're all trying to improve the lives of patients at the end of the day. We're doing this in different ways. We're doing this in different diseases, but that's what we're doing. And I'm really happy to see that RSNA does this. It's so evident in the way everything is set up here. I think I really appreciate that, just as a member of this community, being able to see the love and passion that's been put into this conference. That being said, it is a lot. There's a lot of people, a lot of things to see, and you really have to filter through what matters the most to you. You're not going to be able to see everything here. I think that is the bottom line. You have to pick and choose a little bit, which is unfortunate because there's so much to see, but you have to decide what is most important to you and find that here at the conference. I've been able to do a little bit of that, still swimming through the overwhelming feelings, but we're figuring it out, and I've been having a great time.
Yeah, the number of times I feel like I'm scrolling through the program just to find the next exhibit to visit is so funny. I agree with Brennan on all those points. And, my first time at RSNA, I think, was in 2022. And at that time, to Brennan's point, seeing everyone being so passionate about, improving medical imaging for the patient has been really awesome. But, I think too, is just that the community, it's a multidisciplinary, for, I guess, a lack of a better term. You have your researchers, you have physicians, you have people with a business background or more of an entrepreneurial background, right? And it's targeting all different aspects of radiology, everything from the actual hardware to the software, to the PAC systems, to sharing and accessing imaging, right? Like, it really covers all the bases in the clinical workflow that I understand. So I would say, especially if you're a trainee listening to this podcast, if you haven't already, you absolutely need to attend RSNA at some point, because you just never know what you'll find here and who you're going to meet. And there are just so many cool aspects that you didn't even know existed to radiology. So, and in coming back a second time, I think this point has just been so apparent to me. And it's really cool to hear, like Brennan said, the camaraderie that everyone has. And there's just so much to learn that wanting to come back to RSNA.
I've been like attending RSNAs in like for the past 4 years. And the RSNA is always like very overwhelming with its very massive scale, thousands of attendees and cutting edge technology displays. And between the networking session and technical exhibit and educational presentation showing AI powered imaging and revolutionizing diagnostic tool, it's always being very intense, but it's invaluable experience for being a student or trainee or like being radiologist and engineering, navigating the latest research or innovation, especially in medical imaging.
Yeah, I've had an amazing time so far, but one of the things I wanted to ask you guys and get your opinions on was some of the trends that you've seen across maybe the academic presentations or the industry presentations. The one I've noticed the most, and me and Tom were walking around the exhibits earlier looking at these, there's a lot of integration of AI into PACS systems. So are there any other trends that you two have noticed in either the academic exhibits or in the industry exhibits that you'd like to mention?
Yeah, I think I've been paying a little bit more attention to the software slash AI side of things. Unsurprisingly, I am seeing more and more exhibits with foundation models. Foundation models have been gaining significant traction especially in the academic setting. And so it's really interesting to see how people are leveraging foundation models, whether they're just explicitly language models or vision language models for a variety of imaging modalities and diseases. So that was one trend I thought that was interesting. I also think another trend is cloud scaling of these AI applications and maybe even like a now again, I'm not a radiologist, so maybe, cloud-based PAC systems isn't necessarily a new thing, but I do see I've been noticing more and more technical exhibits with like cloud-based PAC systems or cloud-based integration of AI architectures.
I would say that the more like academic presentations I looked at, especially like the mostly people are talking about the, as Tom said, about the foundation model and agentic AI and these kind of the topics that I saw during the scientific presentation, and I went to the technical exhibit and corporate the sessions. So they are also kind of the same thing that how they are trying to bring such foundation models to the industries and how can they bring to the clinical practice. This is like kind of I've been seeing like since I arrived.
Yeah, definitely. Foundation models and their applicability in clinic is seems to be a big focus from what I can see. And like I said about the AI integration into PAC systems, there's multiple exhibits that I saw that were discussing how to integrate foundation models into PAC systems. And I think the big question there might be clinical approval, but we will have to see. This is a, up and coming field, niche part of our field, so we'll have to keep an eye on it. So to wrap us up, what was a small little addition to RSNA that really made it special for you this year?
Yeah, so I think having the opportunity to record a live in-person podcast is super cool. So that's mine.
For sure. Yeah, this has been awesome.
Yeah, and I feel like we need to figure out a way to do this more often. We'll figure it out.
Yeah, it's going to be hard to go back to old virtual, but I'd say for me, my special thing was the espresso machines at some of the exhibits. Getting a latte just out on the exhibit hall, ooh, perfect.
And I was there that moment. Brian got his latte, and he said it was like one of the best lattes he's
It
ever
was
had.
really, really good. And I am very picky about my
Very
coffee.
picky.
So good on you. Don't know your name, but thank you for making me an amazing latte out in the exhibit hall. I appreciate you.
So with that, I hope everyone had the opportunity to have a latte at RSNA. Thank you for spending time with us today. Thank you to Brennan and Yash for staying here for this in-person live podcast. If you are enjoying our conversations, please rate, review, and subscribe wherever you're listening. Your interactions really help more listeners find the show. For deeper evidence-based insights across the cancer imaging spectrum, from screening and differential diagnosis to treatment planning, check out Radiology Imaging Cancer. The link to the journal will be in the show notes. Again, today you heard from our team, Brennan Flannery and Yash Singh, and special thanks to our editor, Kelly Myers. We'll see you next time on the Radiology Imaging Cancer podcast.